Hello and welcome to everyone. We very much appreciate your time and interest. Today, we'll be discussing new Legionella requirements for healthcare facilities, including important new updates that went into effect on January 1st. For the format of the presentation today, we're going to start off with a 30-minute presentation that will introduce the new requirements as well as other important updates. And this will be followed by a panel discussion. Today, we're joined by 5 panelists who bring a diverse set of perspectives. And while each panelist brings their own unique perspective, all of them have significant hands-on experience and have been involved in implementing water management programs and reducing Legionella risk in healthcare facilities. So both the presentation and the panel will cover the practical implications of these new requirements in depth. And the discussion will come from the perspective of those who have had to implement them themselves. Before we dive into the presentation, I did want to cover a couple of quick housekeeping items. I think that everyone has become fairly experienced with webinars over the past 2 years, but just to quickly cover the basics, all of the audience members will be muted for the duration of the presentation, so please feel free to ask questions at any time via the questions tab on the right-hand side of your screen. We'll put these questions to the panel and we'll answer as many questions as we can during the session today. And if we don't get to your question, we'll make sure to answer it in a follow-up email. Also, this session is being recorded and all registrants will receive a copy of the recording after the webinar. And certainly if you have any technical difficulties, there's a link above the questions tab that can get your issue resolved. And so with that, I'd like to introduce our 2 presenters that will introduce these new requirements, Ben Frieders and Ron Gribick. Ben is a certified water safety and management specialist at GetChemREADY. He started his water treatment career in the U.S. Navy in 2006. And during his time in the Navy, he did 4 deployments on 2 different fast attack submarines as a nuclear reactor laboratory leading chief petty officer and served at a submarine training command as a master training specialist. In 2019, he finished his naval service and entered the industrial water treatment space, focusing on waterborne pathogens, water hygiene, and traditional water treatment chemistry. Ron Gribick is VP of Operations of CWM Environmental in Cleveland. He has over 10 years of experience in water and soil analysis and over 30 years of experience in the skilled nursing facility industry. He developed the water management offering that CWM and its sister company, Armstrong Nutrition, provide to skilled and acute care facilities. These services include on-site risk assessments, water management plan creation, flow diagrams, and analysis performed by CWM's NELAP Legionella Accredited lab in Cleveland. And so with that, I'll pass it over to Ben. The floor is yours.
Thank you, Jeff. Welcome everyone this afternoon to our webinar presentation. Today, we will be talking about current guidance from Centers for Medicaid and Medicare Services on the current water management policies. We'll talk about the new requirements of the Joint Commission in effect now as of January 1st, 2022. We'll discuss the CDC guidance on environmental testing and their updated recommendations. We will cover the overviews of standards and guidelines in the industry for Legionella water management, and also discuss the best practices for management, water management plan management, along with Legionella testing, remediation, and secondary disinfection technologies. As Jeff said before, if you have any questions throughout the presentation, please drop them in the Q&A, and we'll be happy to answer them during the live session. So we come here today, we want to talk about what is Legionella. Well, I'm hoping if we've come to this webinar, you have some idea of what that is. It is the bacteria that causes Legionnaire's disease, but I want to remind everyone of where Legionella actually lives. So some of the most frequent places that are actually found are in the domestic hot water systems and normal faucets and showers, along with ice machines and public water supply. Non-potable water sources could include cooling towers, humidifiers, pools, and spas. What's actually required for Legionella to infect a person? Well, you require aerosolization. So showers are a common culprit. The mist from showers, if they have bacteria in the showers, would cause that, along with cooling tower aerosolization. A quick note on cooling towers. Modern mechanical devices have actually helped eliminate a lot of that that is exposed to the public out of the top. You see the drift eliminators there on the picture. Previous models did not allow for that. So the risk for cooling towers exists now for maintenance personnel and going inside of that cooling tower and dealing with the basin and the water in those circumstances. So why do we care as healthcare? Well, since 2020, reported cases have increased more than sixfold, with 10% of known cases being fatal. However, specifically for healthcare facilities, it could be up to 33% fatal if contracted. So, as we all know, the CMS required water management plan policies and guidance to minimize this risk in healthcare facilities. Wanted to go over standards, guidelines, and memos for Legionella Water Management Plans. So if you're unaware of any of these documents, I'd highly encourage you to take a screenshot or write these down as I discuss the overview of each of these and how they can apply to your facility. So I'll start from the top and work my way down. Ashrae Standard 188 discusses the requirements for water management plans. So this is for building owners, not just specific to healthcare facilities. This is where you will find the 7 core activities and the requirements for how to develop and what to put in your water management plans to reduce the risk for Legionella. So if Ashrae Standard 188 is the requirements, what is required, Ashrae Guideline 12/2020 is the implementation step of the water management plan. So it gives you practical guidance behind how to implement plans for your facility. And in the guideline, it discusses specific components to include hot water tanks, cooling towers, pools, and spas of how to actually implement water management plans in those specific circumstances. Cooling Technology Institute Guideline 159 specifically deals with how to reduce Legionella bacteria in cooling towers. These include startup and shutdown procedures, recommended disinfection steps, and what to do if you were to find bacteria, other waterborne pathogens, and Legionella in a cooling tower, and what to do about it. The CDC Toolkit, in conjunction with Ashrae 188, they have taken the requirements of Ashrae 188 and developed a toolkit with pictures and diagrams of easy to understand what to do and how to develop a water management program. So consider the 188, the black text, and CDC Toolkit has pictures and diagrams for easy to understand for facility managers. Centers for Medicaid and Medicare Services memo is the memorandum that was sent out in 2017, updated in 2018. We will go over here in a bit the requirements for healthcare facilities. So this discusses the requirements for hospitals, critical access hospitals, and skilled nursing home facilities, requirements for developing a water management plan. Joint Commission Environment of Care 020502 is new, in effect as of January 1st. We'll discuss that more in depth here shortly. VHA Directive 1061 is directly concerned with VA health facilities and how to minimize Legionella risk. And I've included this last one. Some of you may not be familiar with this. This is the American Waterworks Association framework. This framework and toolkit was developed in 2020 in response to limited occupancy to buildings with stagnant water. So in here, I've included this. It has actual recommended procedures for flushing stagnant loops, how to sanitize, how to shock disinfect, and it's got practical guidelines and procedures for facility managers. That brings us to the CMS Memo 2017. So as I spoke before, they put out a memorandum in 2017, which was updated in 2018, which required health care facilities to develop water management plans. So I want to remind everyone what that memorandum actually says if you haven't looked at it in a while. The expectations for healthcare facilities were to create water management plans and document that each facility has performed a risk assessment develops and implements a water management program that considers Ashrae 188 in the CDC toolkit, in addition to specifying the testing protocols for Legionella, acceptable control ranges, and then documenting the results of testing and corrective actions. In addition to understanding federal, state, and local laws in regards to your healthcare facility. It mentions Ashrae 188. So this was also updated in 2021 and the CDC toolkit. So if you're unfamiliar with what those look like, that's where you would find these online. If you don't have this Ashrae 188, I highly encourage you to get a copy of it for yourself so you understand what the requirements are for your facility. That's what the CMS memo references directly in requiring the development of your water management plan. And along with the free download from the CDC website, the toolkit, also updated in 2021, updated guidance for environmental testing and how to actually implement those water management plans. In general, the Ashrae 188 CDC toolkit talks about the 7 core activities. I want to remind everyone of what they need to do in developing and managing a water management plan. So first, you need to establish a team. Designate a person or individuals who actually have authority to make decisions in terms of building water management systems and maintenance practices. Second core activity includes describing the building water systems using text and flow diagrams. So this should be an easy diagram to understand from the public water supply source to each of your points of use in your building. Identifying the risk areas where Legionella could grow and spread. Once the risk is identified, deciding where the control measures should be applied and how to monitor them. Establishing ways to intervene. And then making sure the program is running, as designed and is effective through verification and validation steps, which we'll talk about briefly later. And then finally, documenting and communicating all these activities to the team and to the facility. So this brings us to the new requirements of 2022. So up until this point, this has all been in regulation since 2018. The CMS has placed guidelines. Last year and issued March of last year, the Joint Commission strengthened their requirements and their stance on Legionella water management plans. They updated their Environmental Care Standard 020501 with 020502, which now requires and strengthens the language for hospitals and nursing care centers to have a water management program that addresses Legionella and other waterborne pathogens. So I know many of you are here and say, well, I'm not Joint Commission certified, so why does that matter? Well, the Joint Commission is the entity that enforces the CMS memorandum. So even if you are not certified or accredited through the Joint Commission, the fact that the Joint Commission has strengthened its stance, they are making healthcare facilities more accountable for their water management plans. So gone are the days where you have a plan that sits on a shelf that tells a generic list of maintenance activities. It will require additional proof of documentation, corrective actions, annual reviews, and then proof of validation of the plan, all in accordance with Ashrae 188. So since this is the new standard in effect as of this year, I wanted to go over what the specifics of what the Environmental Care Standard actually says. So I'll go over an overview. I won't read this entire thing, but in general, EP1 includes that the water management program has an individual or team responsible for the oversight implementation. EP2 discusses some of the things we just talked about in accordance with Ashrae 188. So a basic diagram, identifying the risk, identifying stagnant areas and buildings, and a plan for addressing that. And specifically for healthcare facilities, as the Joint Commission, evaluation of patient populations to identify patients who are immunocompromised and a plan for those patients, in addition to monitoring protocols and acceptable ranges for control measures. EP3 and EP4, this is some of the changes that will be vital for healthcare facilities to understand in terms of their future audits. So this includes documenting the results of all monitoring activities, corrective actions and procedures to follow if a Legionella test falls outside acceptable limits, and then documenting corrective actions when control limits are not maintained. So a lot of documenting in that EP3, which is going to be vital for the success of a program. EP4 discusses additionally to review the program annually, and also when changes have been made to a water system, such as renovations or new additions to buildings, and at-risk water systems that could be a potential source for Legionella. So as I just spoke, commissioning a new wing or a building. So in summary of the implications for healthcare facilities, EP3 and EP4 will be the thing that facilities might find themselves changing the most in terms of reviewing their plan. Most facilities have a plan as required by CMS back in 2017 and 2018 that includes the team and the diagrams and the general parameters of Ashrae 188. Where people may find themselves falling short for their facilities is the specifics of their documentation. So this includes logging the measurements of the parameters per the plan. So in practicality, that means hot water temperatures, boilers on site, disinfectant residuals, potentially pH, depending on what your plan calls for. Documenting when control measures are not met. So if, for example, real life, if you've come across a boiler, your maintenance technician logs, the temperature was supposed to be 140, but it was 125. The thing that you have to document now is say, we found this control measure out of range, but not only that they found it out of range, what did they do to correct the situation? And then verifying on the back end that the action they took was effective in correcting that issue. So again, a lot more documentation will be required during an audit. Specific actions laid out for a positive Legionella result. This includes specific remediation activities. So I find myself with a lot of customers saying, well, I've got a positive Legionella result. What should I do? Well, my first question is, what does your plan say? So if your plan does not have those specific actions laid out, you may want to review that plan to see what you should do moving forward. And then finally, documenting the annual review of the plan and the meeting notes with your team and reviewing any plan during renovation or construction would be the big things for EP3 and EP4 that are new and in effect as of January 1st of this year. Again, a quick note, if you have any questions about specifics on that, please drop that in the chat as we move forward. So that was new from the Joint Commission. So moving on to the new guidance from the CDC. So as I mentioned before, in 2021, the CDC updated their toolkit that had some recommendations that were surprising in the water treatment world. Surprising in the fact that before the last year, the CDC did not have an official stance on environmental testing for Legionella. And by environmental testing, I mean routine, regular testing for healthcare facilities or other building owners. Leading to this confusion, the 2018 CMS Memo update states that the CMS does not require water cultures for Legionella or other opportunistic waterborne pathogens. Testing protocols are at the discretion of the provider. This led to some facilities believing that reversion of the 2018 memo that they did not have to test for Legionella at all. But if you look at Ashrae 188, Legionella testing is the only way to validate an effective water management plan. So what else did the CDC update in 2021? Well, this is straight from the CDC's website, and the updated guidance for 2021 says that testing may be useful for routine and non-routine purposes, such as 1, establishing a baseline for measurement for performance indicators. And number 2, highlighted there, validating a water management plan. So the big update that healthcare facility owners and managers need to understand is that the CDC's official stance now is that routine Legionella testing is essential in validating a water management plan. Other reasons to do routine testing are listed there, but being in the healthcare space, again, underlined straight from the CDC's website, is routine testing may be particularly beneficial for facilities that house or treat individuals at increased risk, i.e. healthcare facilities, senior communities, and outpatient clinics. So the stance now, historically, which has been absent from the CDC, now in plain language on their website, is that they recommend routine Legionella testing to validate your water management plan for healthcare facilities. Additional guidance from the CDC that came out in 2021, historically, they did not have an interpretation of results. If you can read that text, I know it's a little bit small. Wanted to talk about some of the high-level things in terms of positive Legionella tests. So here on their website as well, they have a performance indicator interpretation. 3 categories: well-controlled, poorly controlled, or uncontrolled Legionella growth in water systems. They also, in the gray area, have split that between potable and non-potable water. Most of the non-potable water, which would be affected, would be, like I mentioned before, cooling towers, pools and spas, and decorative fountains would be considered the non-potable water. So they're straight off the CDC's website in plain language would be their considerations of a well to uncontrolled portions of their system. So for potable water, normal drinking water, detectable up to 0.9 CFUs per milliliter would be considered well controlled, while poorly controlled would be 1 to 9.9 and uncontrolled greater than 10. And then if you look at non-potable, that's an additional factor of 10, 9, 10 to 9, and greater than 100 for non-potable water. So if you haven't had a chance to review this, I encourage you to go on the CDC's website, download. They've got a PDF that you can have as handy for any Legionella results and testing that you can interpret for your facility. But also something you can do to interpret for your facility is I'm going to turn this over to Ron Gribick, and he's going to talk specifically about laboratory testing and Legionella testing. Ron?
Thanks, Ben. For those of you who know me and have talked to me in the past, I'm looking at the clock and I see, to keep things on track, I have 7 minutes or less than 7 minutes. So this is going to be a challenge. I have a feeling that someone in the background is going to be using the shock collar on my that's around my ankle to keep me moving. So if you have spoken to me in the past, since June of 2017, you probably have heard me mention or refer to the Legionella environment as the Wild, Wild West. And certainly with respect to labs, it certainly is applicable there as well. Although, recently there have been some changes, some emphasis on accreditations, certifications to the labs that are trying to create some standardization, and that'll make a difference in dealing with one lab versus another. Why would you as a facility want to deal with an accredited lab or a certified lab? Well, the biggest reason is for the peace of mind. You want to know that your results that you're getting, first of all, are reliable, obviously. Secondly, you want results that are legally defensible. So, obviously, if there's, any kind of legal challenge ever, dealing with a lab who has some certifications or accreditation is going to go a long way, in advancing that cause. So there are a lot of labs out there that are doing testing. Some are accredited, some are not. You should inquire as you're searching around for a lab as to whether they have some sort of a national accreditation or some certification. Certainly, it's worth the effort and worth the peace of mind that you will get. All right, there we go. I'm having a little. There we go. The slide was not advancing. In terms of actual testing for the lab. I get a lot of questions. Okay, thank you. Now that I've gotten my results, I have my report in hand, done by an accredited lab. What does it mean? I had a single positive test. It's what do I do? Is it cause for panic? A lot of that is really open for interpretation. As I said, I refer to again the Wild, Wild West. Ben just had up previous to me taking over a slide on interpretation as to, is something area of concern? Is it an area of uncontrolled, poorly controlled, or well-controlled environment, that chart goes a long way of helping you interpret what that number is on the report that you've just received. One of the recent pushes is your sample size large enough? I know because of budget constraints, there are a lot of facilities that are apprehensive about loading up on the tests, and so that they might actually only do 1 to 3 per session. And the problem with that, I obviously understand from a budget constraint purpose, but from the overall perspective, is your sample size large enough? So we often try to suggest, again, these are all suggestions, there are no requirements, only recommendations. And we try to suggest that you do at least a minimum of 10 samples per building. The idea is that if 30% of those have hits, then you might have to delve into it further and see what is the root cause of the bacteria. If you're only doing one test, it's hard to tell by that snapshot if this is a systemic problem or if it's an isolated incident. So again, the more tests you do, the better off you are. Simply put, again, going back to Legionella testing is the only way to validate a water management plans. There are 2 types of validation, the proactive and the reactive. The best way is the way a lot of the folks I saw in attendance already have a plan in place. And that's the best way to be proactive, because by being proactive, the decision is in your hands. So you can decide what frequency, you can decide how many tests you want to do. When you're being reactive is after there's been an outbreak and Department of Health are involved, and there's a lot more requirements, specific testing is required, and the costs get more expensive with that. So being proactive and staying ahead of the game is certainly one way to approach this. There we go. All right. We just talked about, labs and accreditation. We talked about, why you should do this, the number of sample points possibly. Now, what kind of testing? Oftentimes when I'm talking to folks, I hear folks say, well, I've talked to my plumber and we're going to write a plan and we're going to test the disinfection level, i.e. the chlorine level in the water or the pH. Those are all good indicators of whether or not you have disinfection going on in your system, but there is no guarantee that that level of activity will be enough to prevent the Legionella bacteria from growing in your water. Biggest reason for that is there's a concept called biofilm, that if the biofilm is in your pipes and it encapsulates the bacteria and ultimately gets disturbed by air in the water, by shutting the water off for construction, turning it back on, and that biofilm gets disturbed, it'll release the bacteria that it's protecting into your water system. So the best way to know of what is in your water is to specifically test for the Legionella bacteria. Specifically, there are over 60 versions of the Legionella bacteria. Pneumophila is being the most prevalent that we test for. The reason for that is Pneumophila is the reason for 100% of the deaths caused by Legionnaire's disease. And Pneumophila is also the leading cause for the leading bacteria that's found in cooling towers if you find a detection there. So we are specifically testing for Legionella pneumophila when we are testing your water. So at that point, then you can tell, is your water management plan effective or not? So now that we've gone from the testing, I guess we should take a step backwards and say, okay, what about the sampling of the water? That can either be done by you at the facility level or by the lab with field techs. The idea behind this, the benefit of letting your lab do it, is they're specifically trained in the methods, the proper methods, for example, wearing gloves, using the proper sample bottles. using the proper dechlorination agents in that sample bottle to properly test the water. So by us doing that, you eliminate a lot of the legal responsibility also that goes along with testing and testing properly. So again, it can be done on both ends. Any accredited lab is going to provide you with sampling instructions if you choose to do it on your own. With that, Ben, I'm going to turn it back over to you. I've tried to keep us in time. I think I'm a minute over. I apologize.
No worries. Thanks, Ron. I appreciate it. All right, that brings us to verification validation. So I wanted to remind everyone what that means. So in Ashrae 188, there requires a verification and a validation step. So something we'll talk about best practices here. Something that I want to recommend to facility owners and managers are verification step means that the water management plan is being implemented as written. So what that means is it conforms to the requirements of Ashrae 188. So this is typically done through audits and reviews, whether that's done internally or externally through a third party. The validation step is the step that the CMS memo provided some confusion back in 2018. So validation means that it's effectively reducing the exposure of Legionella pneumophila to the public and employees. So what this means is that you are reducing the risk in your facility that there could be bacteria growth in your system. So examples would be control measures in place, taking temperatures, flushing lines, doing all of those things. But the only way to validate that those measures are effective is to test for Legionella. You can say that your residual chlorine levels have been good all year. You can say that your temperature limits have been in spec, but you don't know if those are effective control measures unless you test for Legionella. So I wanted to emphasize that here today is that the only true way to validate a plan is Legionella testing. So that brings us into best practices going on in the community of Legionella here. So I'm pretty lucky. Our company is part of the Association of Water Technologies, and we have a lot of great resources available to us and other water treaters throughout the country when it comes to understanding what best practices are, what the best technology is there for reducing Legionella risk, and how we can help our customers better. So I've highlighted some of those here today. I wanted to discuss that briefly here at the end of our presentation. So best practices for ongoing review, documentation, and auditing. So one of the things that we recommend to our customer is that we recommend that you meet quarterly with the specific mindset of Legionella water management. I say that because I know a lot of facility managers and owners, they have 1,000 things that are going on every single day, just like we all do. If you don't set aside a time specifically to discuss how your water management plan is being implemented and managed and review the data specifically against that, I think that you have the potential to miss something. And I think quarterly is an effective measurement, is that it's not too often, and you've got 3 months worth of data to make changes to your facility and your plan if you need to make adjustments. Second recommendation for best practices is, especially with the Joint Commission standard, Environment of Care standard in effect as of January 1st, we recommend auditing against that standard now. So review the language, review Ashrae 188, and make sure that your plan, which may have been written as far back as 2017, make sure that the plan is up to snuff in terms of Ashrae 188, but also that the documentation is supporting the execution of the plan. So, and then following that audit here, what I would recommend here perform shortly, I would annually audit, and that's that verification step we just spoke about. Best practices for routine environmental testing. My favorite phrase as a water treater is, it depends. It depends on your facility. It depends on your building. It depends on how effective your water management plan is being implemented. But the best practice in general is it should generate enough data to analyze for that percent positivity rate that Ron was just speaking about. So if you're only taking one test a year from one location, that is not enough data to analyze the effect of if there is a risk of Legionella in your system. So things to consider is the number of floors for a building, the number of water systems, the number of buildings, and then you want to have a sampling of each of those with enough data to make actual actions based off what those results are. So that would be the best practice when considering how often to test for Legionella. Remediation activities laid out. So going back to the resource page, the slide where I talked about all the resources, I referenced back to the Association of, American Waterworks Association framework. So if you're unsure of what to do, if you were to get positive Legionella, or if you have some stagnant water, I highly recommend you go back and download that framework. It's free. You can find it online very easily, but it has very real with the peer-reviewed practices in America for plumbing systems. So what to do, how to flush. It specifically talks about the number of minutes, how long to spend on hot and cold for drinking water. There's lots of great stuff in there that you can utilize and implement right away that is considered best practices in the industry. But not only those remediation activities laid out for your own plan, but also consider having access to vendors who have that additional remediation capability. So that would include the shock disinfection of thermal heat and flush procedures, hyperchlorination, or even rental equipment. The one thing I always come across with customers is they've got a problem and they have to solve it right now. Well, as we know, nothing happens fast in business. You have to establish the vendor. You have to make sure that all the credit checks and all the T's are crossed and I's are dotted to be able to actually cut a check. So if you have something that needs to happen right away, if you've not established that vendor in your system already, then it's going to take longer than you want it to increase your risk to your facility. So consider establishing those vendors ahead of time and having the access to them. And then finally, equipment available for uncontrolled Legionella growth. So if you find yourself in a situation that you have greater than 30% positivity rate, or you've got some uncontrolled Legionella growth, again, have access to the best practice equipment out there. So short-term remediation that protects your staff and residents would be point-of-use filters. The CDC requires it be less than 0.2 micron filters. There's specific Legionella filters out there that are for this, and consider them for faucets, showers, and ice machines. So if you've got a system outbreak and you don't have the capability to do a shock disinfection in a short duration, you could consider point-of-use filters as a temporary solution until you can get the larger fix done. So again, having access to vendors who have that capability. And then in addition to, if you've got a long-term or recurring positive Legionella, consider having continuous disinfection equipment installed in your facility. This is not a fit for every facility, and it's not a recommendation I make for every customer. But if you have continued positive Legionella results and the city does not supply enough disinfection for your water, or you've got plumbing issues in your buildings, you should evaluate the effectiveness, the permitting and operators required, and the safety prior to installing one of these supplemental disinfection systems. But it could be an effective treatment for limiting bacteria growth. And finally, this brings us to our summary here. Some points I wanted to re-emphasize. I've spoken about most of that throughout the presentation, but review your plan, look at your documentation, pull it off the shelf and look at it and ask yourself, could you pass an audit right now? Do I have enough documentation for my plan? Do I have the temperatures from the boilers? Do I have the results from the cooling tower and the biocide levels that I'm treating it with? Do I even look at the decorative fountain that's in my lobby, and am I doing anything with it? Some of those questions you want to ask yourself and make sure that documentation is up to snuff. Specifically, as I mentioned before, the corrective actions piece, making sure that if you find a problem, that the problem is documented, that you document the action that you took, and then you document that you have resolved that problem with your plan. Otherwise, the Joint Commission and CMS will ask you for additional documentation, and you will have some other implications from that process. Okay, second, analyze the data collected. So you're not just collecting data and documenting for no reason, right? That's why we recommend those quarterly meetings. Analyze the data. Make sure that the plan can actually be implemented. Are there enough Legionella tests, environmental tests for you to actually make a determination if your plan or your maintenance practices are effective? So analyze the data collected there with your normal meetings and your Legionella plan. Third, what corrective actions do you have in place? As I just spoke in the last slide, do you have those relationships set up? Are they set up in your system? Could you, if you had an outbreak tomorrow, could you respond immediately and get your system remediated? Do you have point of use filter access? Some of those questions you should ask yourself and walk through in your head what you would do if you had an outbreak, and be proactive as opposed to reactive if a problem occurs. And then finally, if you've gone through this whole presentation and you find yourself and you say, Ben, I really don't know where to even start, what to even look at. I know I've got a plan. My advice to you would say, consult somebody, a professional, a water treatment professional, a lab, or some type of consultant who specializes in Legionella. Have them look at your plan. Have them do an audit. Just have them take a look and analyze the deficiencies of where you're at. And I think that if we understand the requirements that are new for 2022, and we understand what the best practices are, I think we're all going to keep everybody a little bit safer in terms of Legionella. With that, I will. This concludes the formal presentation process. I'll turn this back over to Jeff for our panelist.
Fantastic. Thank you very much, Ron and Ben. So both Ron and Ben are now going to switch into panelist mode, and I want to briefly introduce the remaining panelists before we start to dive into questions. I think I'm getting a little feedback. All right. So again, please remember that everyone should feel free to ask questions at any time during the session. We'll answer as many as possible. Some of you have already been putting questions in, so appreciate that, and certainly keep it up. We'll answer again as many of them as possible. But to introduce the remaining members of the panel, I'll start by introducing Parker Lacey. He's Vice President of Facilities Management at Trilogy Health Services, which is the owner and operator of over 110 senior living communities throughout Kentucky, Indiana, Ohio, and Michigan. Prior to joining Trilogy, he had experience in an array of sectors from hospitality, sustainability, and building management to civil construction, petrochemical engineering, and in the Marine Corps as an infantry officer. He's a graduate of the University of Nebraska Construction Management and Southern Methodist University Master of Business Administration programs, and he also holds a PMP certification and Six Sigma Green Belt certification. Parker, thanks very much for your time.
Yeah, Jeff, appreciate you guys
next,
having
I'd like to introduce. Thank you. Next, I'd like to introduce Rick Albert. Rick is the Director of Engineering and Plant Operations for Maine General Medical Center. Rick's areas of responsibility are plant operations and facilities, real estate management, and construction management for over 1.6 million square feet and over 30 Maine General Medical Center sites owned and leased in the central Maine area. Rick joined Maine General Medical Center in 2005 as construction manager and became Director of Engineering and Plant Operations in 2008. Prior to joining Maine General, Rick worked for Bath Iron Works Corporation, which is a General Dynamics company, for over 26 years in design, engineering, project management, and program management. Rick is a member of the American Society of Healthcare Engineers, the New England Healthcare Engineer Society, and the Maine Healthcare Engineer Society. Rick, really appreciate you being here. I'm also happy to introduce Patsy Root. Patsy is Senior Manager of Regulatory Affairs at IDEX Water. She has 15 years of experience in water microbiology, water-related regulations, and environmental laboratory accreditation. She's a member of the Standing Standard Project Committee 188 and an author of Ashrae 188. And of course, Ben just discussed the importance of that standard in a lot of detail. Patsy is focused on developing sensible laws, regulations, and guidance to protect public health and ensure safe water. Thank you very much, Patsy, for your time. So there's a real wealth of knowledge on the panel here. So let's dive into the questions. And Parker, I will start with you. Can you talk to us a little bit about what type of supervision you provide over facility managers to ensure compliance with CMS requirements on water management plans?
Yeah, absolutely. So with our water management plan, and to Ben and Ron's point, we work with an outside vendor that provides a wealth of expertise to us, and really helps to frame that water management plan. We then utilize our CMS system that allows us to maintain accuracy of those tests being taken yearly for all those different sites. And each site is a little bit different. So we utilize that system to make sure that those tests are consistent year over year. And we also do hold yearly audits with our experts to continue to understand the changing shape of the regulation and regulation world, and then make sure that we're able to implement those changes ahead of time before those regulations are required.
Great. Some practical tips, and I think very much in line with some of the steps that Ben mentioned and Ron mentioned in the presentation. So I'm not sure how many of those listening in are in the position of creating a new water management plan, whether that be for a new building or otherwise. But Rick, I know you've been in a leadership role during the creation of water management plans at Maine General. Can you describe some of the most challenging parts of developing and implementing those plans?
Sure. I guess in general, as a facilities manager, the words Legionella don't ring happy in our environment. So getting past the stigma of Legionella and just understanding that it is out there would be step one. Mapping of systems, especially old systems, can be challenging, but they're definitely a critical element in getting your plan right. The other thing that has been challenging for us is hunting down existing dead legs in our systems. In facilities that have been open 20, 30, 40 years, a lot of those things may be hidden behind walls. So you're dependent on your resident knowledge to say, hey, what used to be in here? Can we hunt this down? And then changing those policies relative to our internal plumbers, relative to our contractors, to say, when you terminate something, terminate all the way back to the main. There's costs associated with that, but in the long term, it's certainly the best thing to do. The other big challenge for healthcare is that we are in the sweet spot relative to water temperature for Legionella. We're not allowed to exceed 120 degrees coming out of a hot water faucet because of scalding. And as many people know, that is the sweet spot. So some of the mitigation strategies, if you're going to overheat systems, have to be very controlled, right? You got to pay attention. Once you heat that water up, get your system cleared, you got to get back down again. So that, I would say, are probably the top, 3 or 4 challenges.
Great, thank you. Yeah, and I think it's important to know kind of what the areas for potential issues are going into the process. So I think we also want to make sure to take advantage of having one of the authors of Ashrae 188 on the panel. So Patsy, as an author of that document, what components of that standard in your mind are most critical, and are there any that are too often overlooked? And I think you are still on mute.
Sorry.
A staple of the pandemic.
I know, I blame the pandemic. I blame the pandemic for everything. I really would echo exactly what Rick just said, that it can be very difficult from a risk assessment perspective to understand where you have risk, where you have water that might be stagnant or water that might not be the right temperature, and allow the growth of Legionella pneumophila. But I would say that all kind of falls back to your assembly of your team. You want to ensure that you have people on your team that actually understand the structure, or as best they can, And I'd also say that, some of the important people to include that often get forgotten are facilities and housekeeping, because they'll probably end up doing a lot of the verification monitoring. And the other thing that happens that people don't necessarily think about is when you have your corrective actions in place, when you have your plan of action for when you get a test result that you need to respond to, not having a complete plan within your water management program can really be a detriment to you. So one of the things I recommend to people is to do a tabletop exercise. Pretend that something came back and now you have to respond to it. Nothing beats practice, because you don't want to be caught unawares if something does come back and you start to panic. Your plan is to help you get past and not even enter panic stage. So does that answer your question, Jeff, or the question?
Absolutely. Thank you. Yeah, I think it's always, there's many different tools that are used and really useful in terms of interpreting Ashrae 188, but I think always important to go back to the source. And of course, one of the recommendations in that document is to use an accredited laboratory for any Legionella testing, which of course CWM is. Ron, you talked about this a little bit in the presentation, but if you can imagine a hypothetical scenario where I'm a customer and you've just sent me the results of my routine Legionella monitoring, what are the key things to be looking for there, and when should I be concerned?
Okay, good question. I guess if I had to go back to slide, I believe it's slide 18, because I actually made a copy of it. And this is a chart that the CDC has put out. There are various charts. They use different terminology, but they use they're similar numbers. The AIHA, the American Industrial Hygienists Association, also, I have seen one of theirs out in publication. But basically the chart references, a no detect in the lab world for Legionella would be considered basically from a 0 to up to just under 1. 1 colony forming unit per ml. So basically, numerically, a 0.9 to a 0 would be a no detect and not a high level of concern. From there, things start to escalate. So from a 1 to a 10 is a level 1, or considered a well-controlled or a poorly controlled level. And then the next tier would be anything greater than a 10 on the CDC chart. So reference that back in the presentation. It's a good chart, and each one of those basically it dictates what level of involvement you need, from something as simple as no action needed at all for the no detects, to a mild flushing and retesting, to doing that again and then retesting. And if you're still getting results, some intervention, things that Ben was referring to, certainly would be possibilities, whether it be point of use filters, hyperchlorination and so forth. Things of that nature are all possibilities.
If I could add on to that real quick, Ron, you mentioned this during your portion too. The other thing is that a single positive Legionella test, even if it's greater than 10, it's not a cause to panic, right? But you also need to make sure that testing is in conjunction with enough data collected to analyze the percent positivity. So just like Ron said during his portion, you need to, we recommend taking at least 10 samples for regular routine testing. That'll give you the direct ratio. If you've got 3 positive results, that 30% is that threshold of an increased risk to Legionnaire's disease. So it's indicative of a whole system issue versus an isolated incident if it may be above 10. So something else to consider.
Great. And so just looking at the time, I'm going to jump into some of the audience questions because there's some really great questions here. So one, and I think maybe Ben, start with you, but everyone should feel free to jump in. We've got a question saying from somebody who checks for free chlorine, pH, and water temperatures. Is that enough? Is the question.
Okay, good question. As I spoke about before with the validation step of Ashrae 188, and I'd be glad for Patsy's input on this as well. While those control measures are in effect to mitigate the risk of Legionella, the fact that the question is that enough? In order to validate if you have Legionella in your system, which is the whole purpose of the water management plan, you don't know unless you test. So is it enough from a regular control measure monitoring check? I'd also say that depends on your system. If the results of the Legionella test show that the free chlorine levels, pH, and the temperatures are enough, and your Legionella testing confirms that, I would say that's enough of the maintenance practices. But if you're not testing for Legionella, then you don't know if it's effective for your plan.
Anybody else want to jump in on that? I don't know, either Rick or Parker from.
Yeah, I would agree. Those tests, we test chlorination annually, we test water temp monthly, but we Legionella test every quarter. And again, 10 samples, random places throughout the system, to kind of get the full kind of geography of the buildings. But I don't think you can do just those tests and not test for Legionella.
Yeah, I completely agree with Ben and Rick on this. This is you're kind of flying blind without getting that testing. You can have all the right pieces, and you can be, even where you are geographically, right, and the age of the infrastructure of the water system coming into your facility, even if it's a newer facility, can greatly affect the likelihood of Legionella being present in your facility. So you may have all those right pieces, but still be dealing with Legionella in your facility. And so if you're not testing for it, you're really flying blind at that point.
I would say too, just to add one other thought to that, is the fact that if you have all of your measures in place and you're monitoring and you're verifying everything is happening as it should be, but you're not validating by testing, you're validating by epidemiological surveillance, and something happens, I assure you that whoever came down with that case in that facility will want to know why you weren't testing. So
I think we have time for one more question, and I think this one is a good one to end with. As we've sort of alluded to, there can be a lot of concern, a lot of anxiety around this topic. So I think this is an important question as well. If a healthcare facility has a high level of Legionella, are they required to notify patients or test patients in the area where the Legionella is detected? So I don't have a suggestion for who should take that, but
I go for Rick.
I would love to take that one, actually. So it actually is dependent on your water management plan / program, right? So part of our water management team is our risk management folks. So there is a determination made when you're developing that program, is at what point do you notify the next level of management, senior management, and then the public. So that has to be part of your plan. Now, determining high level would vary from facility to facility. Like the guys were talking about earlier, if you're testing 10 locations and you get one positive, that obviously is not anything that, I'm not going to say you don't worry about, but it doesn't get to the level of panic. If you're testing, you will know, hopefully you will know before there's an event outside of the testing that was caused by Legionella. So the whole idea behind the testing is, right, get ahead of it. We did testing here, found low levels Legionella in one of our water features outside, treated that feature, retested, everything was clear. And then in the next quarter, we will retest that feature again because we know we had that incident occur.
In the interest of time, I know we're right at the top of the hour. The last thing to consider is that it's not required so much if you find Legionella in the system, but if you have a facility, patient, or somebody contract Legionnaire's disease, that would be the required notification to the health department. And then if you have, I believe it's 2 within 1 year, that would require a health department directed assessment of your facility.
True.
Great. Well, so I know we're at the top of the hour. People probably have to go to their next meetings. So I wanted to thank the panel, thank all the attendees for your interest. Just to close up here, I'll say that if this after this overview, you're considering your facility and saying, yep, everything seems to be in good shape. This was a good validation, so to speak, of that everything is going well. That's great. We hope this has been a helpful session. If after this you're saying, hey, there's a couple questions that I have, or I'm not sure, or we could use an audit. That is a service that GetChemREADY provides, and would encourage anyone in that position to go to GetChemREADY.com. I don't know, Ben, if there's a more specific website to reference, but
Yep, it should take you right there. There's a Legionella portion of our website, so we'd be happy to discuss anything you've got questions about.
Perfect. Well, thank you all again, and I hope everyone has a great afternoon.
Thank you.